pharmaceutical industry influences medicine and science at every level.
There are underlying factors to psychiatric health that are being neglected and that are extremely important. And as soon as Bobby Kennedy becomes president and more money gets put towards these sorts of research studies and clinical issues and that shifts, everybody else will see this too.
Good morning, everyone. This is Paul with the Curators Podcast and my lovely co-host Brenda, who is the producer of this podcast as well. Welcome, Brenda. Thanks for being here.
Hey, guys.
And we have two wonderful guests with us this morning, Dr. Elena Monarch and Dr. Sylvia Fogel. And I will introduce them both right now. It'll take a moment here. Dr. Monarch obtained her master's and Ph.D. degrees in psychology from Emory University in Atlanta. She has worked in the field of neuropsychology for 30 years. Dr. Monarch has published research studies in the areas of health psychology, emotion and fear processing, and neuropsychology. In 2016, Dr. Monarch opened her own multidisciplinary clinic, the Lyme and PANDAS Treatment Center, where she and her team investigate and treat underlying triggers of mental illness. While continuing her clinical practice, Dr. Monarch also works as a research consultant supporting innovative research efforts aimed at preventing misdiagnoses in the future. Wow, that's very, very impressive. Thank you. Dr. Sylvia Fogel received a BS in Human Development and Family Studies from Cornell University in 1994. She received an MD from Cornell University Medical College in 1999, and then a residency in psychiatry at Columbia and the New York State Psychiatric Institute in 2003. Until 2017, Dr. Fogel was an assistant professor of clinical psychiatry at Columbia University. Over the years, she has increased opportunity to work with the parents of special needs children and has had robust experience with issues unique to this community. Dr. Fogel has a strong interest in integrative and complementary therapies to support health and wellness and practices used in functional medicine principles. Well, it is an absolute pleasure to have both of you here today, and thank you for allowing me to introduce you both properly. So welcome, and let's get the conversation started because we have a lot to talk about, right? I think either one of you can start first with this question, and that is, what brought you to this path? It may or may not have started out like you may not see yourselves today where you thought you would be. I think that describes both of you to some degree. Dr. Monarch, how did your path take you down this road?
Thank you for having me. So I like to say I was minding my own business. I was a neuropsychologist, loving my career. I've always been fascinated by the brain. And I was determined to be the best neuropsychologist that I could be. And neuropsychologists, our job is to, parents will come to us, or a school may come to us, teachers and so on, and may ask, or adults, people with brain injuries and so on, they'll come to us and they will say, I'm experiencing X, Y, and Z symptoms. I'd like to know why they're happening. Is there a diagnosis associated with those symptoms? And what we do is, and do we have recommendations to help them improve and to help them improve the quality of their lives? And I was, going about that work. Again, I was trained at Emory. We had a great program there, and this was the 1990s. And I was doing that work. I did a wonderful postdoc, had a wonderful postdoc experience at University of Washington Medical Center, and I ended up coming back to the Northeast and was evaluating and doing a whole bunch of neuropsychological evaluations on children and teenagers. And I started to notice that there was something different happening this was the early 2000s. There was something different happening where some of the patients that I was testing were not fitting neatly into all the diagnostic categories that I had been taught in grad school and that I thought I was really good at assessing. And I would say about a quarter of the patients that were coming through for these neuropsychological evaluations had just a different constellation of symptoms, and the diagnostic categories were not applying. And I was beginning to feel like I was missing something. And lo and behold, about 15 years ago, I learned about Dr. Sue Swedo's work at NIH. Dr. Swedo did some research showing that some kids with strep were experiencing neuropsychiatric symptoms. So things like OCD, sleep problems, motor tics, and a host of other symptoms. And as I learned more about her work and others that followed, I had a complete a paradigm shift in my thinking, because what she showed was that the blood-brain barrier that normally protects our brains from any sort of immune processes or toxins or other irritants in the system, that in some people, and especially in children and teenagers, that blood-brain barrier was beginning to experience a leak, if you will. And that inflammation, antibodies, and such were starting to cross into the brains of some people, and that this looked exactly like a psychiatric illness or neuropsychiatric illness. And as I learned about that work, I realized that the health of the brain was being compromised, and that a lot of the symptoms that kids and teenagers were running around with in terms of attention problems and motor tics or severe anxiety, even symptoms that look like bipolar disorder and spectrum disorder, that a lot of those kids and teenagers actually had some brain inflammation. And once I realized that there was this whole health component to psychiatric illness that we had not appreciated before, it really shifted my way of looking at how to help people, at how to diagnose them and help them. And at a certain point, I shifted into making sure I was diligently ruling out all the potential health reasons why someone may experience anxiety, OCD, sudden onset neuropsychiatric symptoms. And as I began doing that work, I realized that that not by myself, but with a team of other practitioners, that we could actually heal and reverse psychiatric illnesses a great deal of the time, much more often than I would have ever dreamed that we could do. And once I began to see those recoveries, those are not things you can unsee. And I decided to dedicate my career towards preventing misdiagnosis, to helping address all of the health reasons why a child, teenager, or an adult can experience psychiatric or neuropsychiatric symptoms.
Sorry, Paul, go ahead.
I'm sorry. I just wanted to say I wanted to ask Dr. Fogel the same question, but what you're saying here to me, Elena, is that this is a major discovery, and it is one that is fundamentally rooted in patient care first and foremost. And I think the message there is so important, and I hope our audience can understand that. You know, that's a really, really key concept. Not to paint your description with too broad a brush, but I think at the very least we ought to grasp that concept. Brenda, please go ahead.
The thing that jumped out at me right away was, I think when people think of mental health, they think it's psychiatric, but what you're saying is you have to look, the body and the brain are all, it's all human, and you have to look at everything. And so if there's something going wrong in the body, all of a sudden your aperture opened up, realizing that there's so many things that could be going on leading to mental health issues. So you're right, Paul. It's like, it's so important what you just said. And so many people still don't realize that. So.
Right.
And I think that's probably always been the case that, the nervous system is part of the body, and, mental health may have always had some sort of a health component, but this is a much, much bigger problem now than it was in the 1990s when I first trained as a neuropsychologist, because people's brains are getting less and less healthy. And
we'll talk about that.
Yeah. Before I share my own story, I will just add that, as psychiatrists and psychologists, we're supposed to rule out medical causes of psychiatric symptoms. I don't think it happens as often enough as it needs to. And usually that involves very basic kinds of medical workups, very basic, maybe kinds of vitamin deficiencies, very basic kinds of autoimmune disorders. I think we are not taught or trained how to really systematically think about the influence of the immune system on brain functioning and how intertwined those systems are, right? The brain resides in the body. And to really think about more subtle kinds of immune dysfunction or immune dysfunction triggered by infectious etiologies. Like, it's just not part of our training. Anyway, yes. So I'll shift to my story. So like Elena, I've always been interested in the brain. When I was training in medical school, I did research in functional neuroimaging, which looks at the neural correlates of both behaviors and or psychiatric symptoms. I was lucky enough to have trained at Columbia, where we really thought about, multifactorial inputs to health and psychiatric health and to psychopathology. So that was always part of my training. At some point towards the end of my residency training and afterwards, I was involved in the field of perinatal psychiatry, so treating women who were pregnant and postpartum, who either had a history of psychiatric illness or who were developing psychiatric symptoms. And again, here too, the nature and kinds of really multifactorial inputs, including stress, nutrition, prior history, family history, like really thinking about how there are multiple inputs, multiple factors that, excuse me, that can lead to either brain health or psychopathology. It was really sort of through my own life circumstances that I started to dig deeper into this model and to really consider things like immune functioning, infectious etiology. I have 3 children now, but when my middle son was 2 years old, he had an acute regression. He lost language, he lost social capacity, he developed a series of odd motor movements. I was affiliated with Columbia at the time. I saw all the best folks in New York, and no one really had an answer for me about why this horrific thing happened to my son after he had been ahead for development in language, ahead in his motor development, after he was doing, pretty well. So that really led me on, sort of a decade-and-a-half journey into really thinking about the root causes of illness and really learning more about PANDAS and neuroimmune conditions. And so here I am.
Wow. How is your son now?
He's almost 16, and he's a lovely soul, and he brings so much light into our family. But he's profoundly impaired and needs 24/7 support, and probably will for the rest of his life. So, I've walked the walk that many families in the United States and around the world are faced with, which is, severe developmental, and I think often also neuroimmune issues that really impact day-to-day functioning.
That story hits me to the core, Sylvia. It really does. And you're right. It's very, very common, and it kind of highlights this powerlessness that we all have in understanding the complexities of everything, so we have to ask questions like, what is behind the surge in chronic disease? I think the numbers, as I understand it, are that when I was a young person, there was something like a 6% chronic disease rate in the country, and today that number is 10 times greater, 60% of our citizens, and it's particularly disturbing among young people, I think. I'd love to get your thoughts on what you think might be behind that, in terms of any environmental causes or studies that you've been involved in or know about that could explain why that is. Have you guys any thoughts on that?
Well, I think, first off, I don't think there's any one factor that's responsible. So I think this really is multiple factors that are unfortunately leading to a confluence where our health as a nation and even across the globe is really being compromised. But I think there are a few major things to think about. I think the first is our food supply. I think eating the wrong kinds of foods, highly processed foods, non-nutritive foods from an early age. I think also our food supply is heavily loaded, with pesticides and other environmental contaminants, which have known and scientifically validated negative impacts on human health. And again, we're being exposed to these environmental contaminants, not only from childhood, but in utero. And then I think there's sort of environmental exposures more broadly. So, chemicals and solvents and things used in industry, in agriculture. And I think also our lifestyle is contributory. Also, we've become more sedentary, less time in nature. So I think it's a sort of a confluence of things. Elena, do you have?
Well, yes, and I do. Yes, and I will definitely. I agree with everything Dr. Fogel said, and I will contribute to that a little bit. But one thing I just want to remind everybody listening, because I think a lot of times, because I think this gets lost in the shuffle. Now that I'm in my 50s and I've been doing this, I started doing this sort of work in neuropsychology when I was 21. And I want to say that children were sharper back then. They had better attention spans. Their memories were unbelievable. They were quick. So I just want to remind everybody that kids used to be, we were in awe of what children used to be able to do. And that's not a ding on the children of today. I just want everybody to remember that when we're young, we at preschoolers, elementary school, middle school, high school, are you kidding me? It was incredible what kids and teenagers and young adults could do because they were physically strong, their minds were sharp. Okay, and now if you ask teachers who've been in teaching for decades, people at the end of their teaching careers, they will tell you that if you put side by side preschoolers or even high schoolers, from 30, 40 years ago to them now, they are much lower functioning. Their attention spans are worse. They have far more learning disabilities, far more issues that would be considered, on the spectrum. And they're slower. They're harder to manage. They have more behavioral issues and more mental health issues. And so I just want to remind everybody, like, there has been a major loss, even just during my lifetime, right? And so when, to me, this is a crisis, right? What has happened over the last 30 years is unbelievable, and we should have all hands on deck about what is happening to our children and their development. And when you asked about whether there was, like Dr. Fogel said, well, there isn't one factor, there's many factors, and I agree with that. But if we were to try to look for one factor, it would be that there is nobody out there in a position of power. There's no policy, there's no organization, there's no government agency trying to protect our children from all the insults coming at them, all of the toxicants and all of the factors that Dr. Fogel brought up. Nobody is paying attention to this and protecting them.
Well, I think this brings up our interest in Bobby Kennedy, because I think he is one of the only national candidates and the only presidential candidate that is really speaking to the massive rise in chronic illness, the rise in developmental disorders. So we can get back to that. I did just want to say one thing about, what Elena said. It's not just Elena's clinical anecdotal experience that kids are less well. We know that there have been massive rises in rates of autism and other developmental disabilities, in ADHD, in learning disabilities. And in fact, not only is there not a coordinated national effort to understand why this is happening, I think our, experts and our, lauded health agencies are kind of relying on the idea that this is better diagnosis. Now, it may be better diagnosis for more subtle kinds of issues. I don't dispute that. We are better at identifying things now. But there's also been, I believe, and so do many others, and I think the data overwhelmingly suggests that there has been a real rise in the rates of neuropsychiatric and developmental illness among children that corresponds to an increase in physical illnesses also, like asthma, inflammatory bowel diseases, peanut allergies, food allergies. So, why it wouldn't be that the brain is somehow, immune from what we see as increases in real physical illnesses, it doesn't make sense. So, we're here because we believe that there is a health crisis, there's a brain crisis, and we really appreciate that Bobby Kennedy has been speaking openly about this, that he has ideas about how to address these epidemics. And, that's really meaningful and important to us, both professionally and obviously for me personally as well.
We're going to jump into that. Let me just ask you quickly, when you speak to colleagues like in Europe or other parts of the world, is there, obviously, I know like autoimmune issues are going up all over the place as well, but is it worse in the United States? I know it's bad other places too, but do you think it's worse in the United States versus other places, or hard to say?
Look, I think the obesity epidemic and metabolic dysfunction appears to be worse in the United States. But for things like autism and other neurodevelopmental disorders, the rates are high in other, in Western Europe, Ireland. So I think this is a global phenomenon in terms of brain health. Yeah.
But we do spend more money on mental health and on health in the United States than other countries, with no better outcomes whatsoever.
Worse. Worse outcomes. Yeah.
And
Do you find it like doctors often just, like Sylvia, you were saying, ruling out some basic things with some blood work, basic physical issues, but do you think doctors in the United States are more likely to give some sort of psychiatric medication to teenagers, for example, rather than really digging deep to see what's going? Does that happen more in the United States versus in other countries, do you think?
I don't know.
Mm-hmm.
I can't speak to that. I don't feel like I have the personal or clinical or professional experience. But I will just add that I think, people go into medicine because they want to help. And when you have a patient in front of you who is suffering and unwell, and maybe even, suicidal or violent, and you don't have a lot of tools in your toolbox, you're going to reach for the tools that are available to you. And I think one of the issues is that, our training as physicians is so heavily focused on pharmacologic products and not on, lifestyle interventions, prevention, or even, these deeper kinds of root cause analyses, or, what we call functional medicine, like really trying to understand, is there an infectious component to what this person is experiencing? Is there a nutritional component in terms of, not eating enough nutritive, in foods, or eating pro-inflammatory foods? What's their GI functioning like? What's the state of their gut microbiome? We know that, there's beautiful animal data actually, this is in rodents, but that shows that the gut microbiome has direct impact on brain functioning and neurotransmitter levels via the vagus nerve. And that's to say nothing of, that the microbiome produces vitamins. It produces substrates that are necessary for healthy brain functioning. It regulates the immune system. The largest conglomerate of immune tissue is in the gut. It's called gut-associated lymphoid tissue. So, there are things that we could be thinking about, but I think most doctors, even though they mean well, just haven't been trained in thinking about these methodologies or even knowing how to implement them. So I think, they reach for the tools that they've been trained with, which, a lot of the time are, pharmacologic.
And is this because the pharmaceutical companies are really the biggest donors to medical schools, I would imagine? Do you think that's part of the issue?
I think the pharmaceutical industry influences medicine and science at every level of the medical and scientific establishment. So,
and the public.
Yes. So they influence and fund medical schools and chairmanships and chairs at different medical schools. Yes. They are deeply involved with continuing medical education. They are large funders of scientific investigations. So, and then of course, people have been talking a lot about this in recent years, but they're also funding medical journals. Mm-hmm. And so the question, and I think there's some evidence for this, about, influence of medical journals and what gets published. And then of course, direct to consumer advertising. And then, people also, I think, rightfully worry about whether pharmaceutical companies, by virtue of the advertising dollars that they spend in our media, are also kind of subtly, or maybe not so subtly,
not so subtle anymore,
editorial content and, what journalists are pursuing and writing about and publishing. So yeah, I think it's
everything,
multiple levels.
one of the things we talk about here, and Brenda's been on a crusade to address a lot of the things you guys are talking about. And regenerative farming is certainly one of those. We've had several guests on addressing that issue, and we're really proud of the work that's being done there. So there is a growing awareness, and a tide is turning, and so we want to stress that this has to start from the grassroots level. This is like the people are finally pushing back and saying, okay, enough. We have and I think of it as we identify these industrial complexes. And if you think of the medical industrial complex, right, the monetary industrial complex, which from my background is more along the lines of Wall Street and all of this debt incursion and this money printing that allows, profiteering on one side, but somebody else paying a price on the other. And that's a whole separate podcast. But those two, and then the media industrial complex, which has us all fighting each other and engaging in this tribalist rhetoric and being distracted from the very urgent issues that you guys are raising, which should be a 5-alarm fire for all of America, where, why aren't the studies being done? Why aren't the standards of care that are being applied putting the patient first, and getting to the root causes like you guys are trying to highlight? So I think, these are the really, really important questions. And I completely agree with you, Sylvia, that, Bobby Kennedy is the one person talking about this. I think you'll probably see a couple of candidates out there who are going to try to piggyback on that in an election year, but, on the margins, right? But the reality is that there's a lot of capture there. The pharma industry and many other healthcare sectors have captured these government agencies. It's a pay-to-play system. There's donors, there's lobbies, there's cushy board seats awaiting these guys when they rotate out of the government into the private sector. We know all of this. We have all of this information, and so the motives are, people like to think that the medical community is so trustworthy. After all, we're talking about our bodies, our well-being, right? We should be able to trust them. And I think at one time we could. But I think the motives are now at the institutional level, at least. That's what I'm
Well, I
talking
think,
about.
Paul, you bring up a really good point when you said, standards of care. I think standards of care are actually directly influenced by pharmaceutical industries by virtue of their funding and support of, professional societies and experts. One great example, I sometimes think people think that the OxyContin and opioid crisis was kind of a one-off.
Exactly.
And there's a beautiful, very detailed report written by Catherine Clark and another person in the House of Representatives that I can't remember, but really detailing the methods that Purdue Pharma used to influence people in various professional pain societies, and how they funded these pain societies and funded these speakers, and how it actually shifted standards of care all the way to the World Health Organization. Like the World Health Organization changed their standards for opioid prescribing in children. It was directly related to marketing strategies from Purdue Pharma. And, this is the playbook for all pharmaceutical products, maybe that's overstating it, but
it's true. There's Netflix documentaries, Hulu, like there's 10 documentaries about the opioid thing and Purdue Pharma, and it's almost like, oh, that's the bad apple. Nothing else is going on.
And
absolutely
yes,
right.
Absolutely. And in the 2008 financial crisis, there was this sacrificial lamb, and that sacrificial lamb was Lehman Brothers. And I think, people like the industry just sort of offers up a company like Theranos or a company like Purdue Pharma, and they say, okay, here's our sacrificial lamb. Meanwhile, we've got the real PR machine going, and we're going to continue to do what we're doing as long as we kind of satisfy the public's appetite for justice by, allowing them to feel good about this one company paying a price or having to settle for billions of dollars. Meanwhile, to them, it's just the cost of doing business, it seems, and it's unfortunate because I know, as we all do, right, that there are doctors out there who really, really do care. And they're I think the ones who are really putting the patient first and perhaps challenging the narrative, challenging the established practices that come down from above, from WHO and so forth, are taking a great risk. They're taking a risk. Have you guys encountered that?
As far as like people putting their reputations on the line, have you felt
in your own experience like you were kind of taking a risk in terms of the approach that you're taking to patient care? Yeah.
Well, I can say when I 15 years ago, when I started looking at brain inflammation and underlying factors for psychiatric and mental health issues and symptoms, in my community in the Boston area, I would say about half of the people around me, including doctors, were glad I was doing it, were curious, had some interest in it. And the other half really were very suspicious of me, told people not to come to my clinic, thought that what we were doing, by looking at the whole person and looking at underlying factors, thought that what we were doing was unscientific. And I still get some of that, though it doesn't really, it doesn't even faze me at this point, because I'm so clear and so certain that there are underlying factors to psychiatric health that are being neglected and that are extremely important. And as soon as Bobby Kennedy becomes president and more money gets put towards these sorts of research studies and clinical issues and that shifts, everybody else will see this too.
Yeah.
Can I ask you, Elena, I know you have quite a few patients where Lyme disease and co-infections are one of the underlying issues. And I know, I don't know if it's still what the CDC says, that basically, 2 weeks of doxycycline and then you're fine, and Lyme disease is just an acute illness. But I'm curious if if you get pushback on that, or do you see, that I see is something that, Mr. Kennedy would do in the first few weeks of office, is go to the NIH. That's one of the things on the list to do, of like, let's really look into this chronic Lyme disease and co-infections epidemic. Do you?
Yes. Well, the IDSA, which is like the Infectious Disease Society, they have not budged much in terms of saying that Lyme disease is easily treatable, easily diagnosed, and they really are not expressing much alarm or innovation around how to help people with Lyme disease. And as somebody who's been working with these patients for 15 years, one thing I just want to remind everybody about is that a lot of people get Lyme disease and don't know that they got Lyme disease. So you have a couple of major problems with Lyme disease. One is, when people get Lyme disease, they may just experience a small, they might think it's a cold or a flu. They may experience no symptoms at all when they first get it. They may have never seen the tick bite. They may have never seen the rash. The rash could have been on their back, on their scalp. They may have had no rash, because that happens also with Lyme disease. So we have a lot of people that, we may call them chronic Lyme. We have persistent Lyme. We have different ways of referring to them. But these are people who never even knew they had the illness. And now it's 5, 10, 20 years later, and they're diagnosed with chronic fatigue syndrome, depression, POTS, migraines, anxiety, and so on. And those patients can absolutely be helped, but they need to know that they have Lyme disease in the first place, and they need to be treated respectfully. A lot of these patients are not heard. They are considered annoying by many medical professionals. I would say a lot of my patients have experienced medical neglect and in some cases abuse, where they're really just keep being sent to psychiatrists. So we have that. So when Brenda, when you said about, we have, that's a whole other chronic Lyme population that, once they get diagnosed with Lyme disease, it's not like 2 weeks or even 6 months of antibiotics is going to resolve all the inflammation, all the immune responses that this person have, all the troubles, their glands, their home endocrine system, like everything that they have been through. It's a lot of work to help those people, but it's very much worth it. Then you have the people, as you brought up, Brenda, who maybe know they got Lyme disease and they went on an antibiotic. It used to be 10 days, and then some doctors were doing 2 weeks. And now you do have some doctors who are willing to give antibiotics for 30 days. They're taking Lyme disease a little bit more seriously. However, there are still people, and it's approximately 20%. So it ranges from 8% to 20%, whose Lyme disease does not completely resolve with that initial antibiotic treatment. Just like if you had a sinus infection or some other illness, an ear infection, how many times have you had to, put your child on 2 courses of antibiotics instead of 1? Or, sometimes infections are more persistent, and Lyme disease is Borrelia burgdorferi is extremely sophisticated bacteria. So to think that you can put everyone on 2 weeks or a month of antibiotic and it's going to completely go away is ridiculous. And the way that doctors treating patients were convinced by Infectious Disease Society that you absolutely cannot give more antibiotic. You cannot give these people more antibiotic if they're still symptomatic. Do not do that. You can do anything else, but do not give them more antibiotic. And it has caused tremendous suffering, including, and just because we're talking about this, there are plenty of women who have been pregnant with ongoing Lyme disease, not known that they've had it, and they're exposing their unborn child to an infection in utero. And then those children sometimes, not always, sometimes are born with a tick-borne disease. And so this is a very big and complicated issue that we could talk about.
We could have a separate podcast just on Lyme.
I just wanted to add, I'd love to add to that, because our public health agencies are not taking certain kinds of chronic illnesses, I think, seriously enough, and that's a personal opinion. I think many patients are then forced to go outside of traditional allopathic medicine and traditional allopathic medical structures and see integrative or alternative, providers.
That was me.
At great personal cost and financial cost to themselves. That, one of my favorite books that really just so eloquently describes this is called In the Deep Places, a memoir of illness and discovery by Ross Douthat, who is a journalist. And he really wrote about what Ellen is describing, being absolutely dismissed by the medical system multiple times across multiple institutions, and then really having to seek out, alternative providers in total isolation and at great financial cost. And the suffering is really significant. I think same thing I know for, parents of children with regressive autism, trying to find answers for what happened to their children, and at the very least trying to improve their health. The overrepresentation of serious gastrointestinal disorders in people with autism that was dismissed for many years, and now we know, of course, that that's a real phenomenon. So.
Yeah, no, if I may, I was shocked to see a New York Times article yesterday that talked about all of the vaccine injured people and how their voices have been ignored over the last X number of years. And I thought to myself, wow, for the New York Times to finally acknowledge something the way they have, that really I took note of that. And so, again, on a positive note, perhaps the narrative is beginning to change. People are beginning to wake up.
Paul, the really interesting thing is Dr. Prasad, the author of that article, Dr. Vinay Prasad, has just been hammering that author for like the last year about how like she's the worst science reporter of all time and just how all of her facts are wrong. And then I almost feel like it's the New York Times finally had to cover themselves, say, have her write this article to just sort of admit, oh, yeah, there's a few cases, just so that they don't look absolutely ridiculous. Like, the dam is already starting to break. But that's how I took it. I may be wrong. But.
There was even a begrudging mention of Robert F. Kennedy Jr. in that article.
Oh, I did not see that. Okay.
Yes. And it was about as close to a compliment as he's ever gotten from the printed version of the New York Times. The podcast version has been much fairer to him. But that being said, Sylvia, what you just said kind of touched on my earlier question, and I wanted to give you an opportunity to answer if you'd like about any of the personal risks or personal costs you've encountered in your journey.
I would say I think this issue really hit home for me during the COVID epidemic and our COVID responses in terms of both our decisions to lock down for as hard and long as we did, school closures, and the use of widespread community masking. In part because of the impact on the special needs and autism communities. And I felt from very early on that these potentially well-intentioned population-level interventions weren't taking into account the risks and harms. We're always taught in medicine you have to balance risks and benefits. And actually, good public health policy does that too. It balances risks and benefits.
Yes.
I didn't see that happening during our COVID response. And in fact, quite the opposite. People who were trying to bring up potential harms or off-target effects or side effects of these interventions were vilified. And I felt the need to be very careful. And of course, I'm not an expert, in epidemiology or infectious disease or public health policy. So, I certainly didn't want to be speaking outside of my expertise, but I am an expert on the autism community. And this community was suffering unbelievably by not being able to access therapeutic interventions, respite care, school services. I had families who were living in unbelievable suffering with their special needs children, self-harming, aggressive toward other family members, with no respite and no support in sight. And it was bad. And I never heard anyone talking about this. And again, attempts to kind of talk about this, people would be shut down. And there was a sense of like just having to be very, very careful about, what you said.
Now, did you sign?
Yes,
I was going to ask you, did you sign the Great Barrington Declaration? Like, did everyone who signed that get a lot of grief from where they worked?
So I didn't personally get a lot of pushback directly for signing the Great Barrington Declaration, although I do know a close friend of mine who is a very well-respected professor of pediatrics at a well-known academic medical center in the Boston area who signed and whose chairman called and wanted to know why they signed. And in the case of my friend, I think they were extremely concerned about the harms to children, losing sports, losing social contact, the developmental sequelae of not having regular social contact with peers, other adults, loss of access to medical care, loss of access to services, loss of access to school, online learning. I think I don't think there's anyone who thinks, I mean, actually, there's a small subset of people for whom online learning was helpful. I think people with serious anxiety disorders and serious kind of social challenges, actually, there's a small percentage, I think, that did better with online learning. But for most people, online learning, was, I can't even call it online learning, like online pseudo school was, extremely harmful. So I think, there was just no place to really talk about harms and risks and benefits. And of course, the Great Barrington Declaration and the three amazing people who wrote it and conceived of it were attacked mercilessly and censored across multiple social media platforms. So yeah, I really felt it then. And I also feel it in terms of giving voice to things that my patients tell me about adverse reactions to medical products. It's, I think, as if I can't even share what parents tell me, like that is somehow too dangerous or invalid. Wow. It was funny. I have a friend of mine who is also an autism mom, and her son has serious neuroimmune issues as well, and sees an immunologist at a well-known children's hospital in the area. And, this really well-respected pediatric immunologist said to her, I hear your story over and over again. And he said, we really should be listening to parents. We should be listening to patients.
Yes,
and acting on that anecdotal information, right? I mean, obviously we want to pursue, not all anecdotal information is applicable to large populations and, it deserves further study and research, but I think we're not doing that. And I think, again, that's another reason why I'm so interested in Bobby's candidacy, because he's really talking about, like, let's do the science we need to do, not only about medical products, but industrial chemicals, agricultural chemicals. And in fact, there's already a ton of science out there that things like PCBs and chlorpyrifos and DDT and different kinds of pesticides we know are harmful to the developing brain and actually cause measurable IQ deficits. This work has been done for years by multiple people, including someone named Phil Landrigan, who was at Mount Sinai for many years and now is at Boston College. I mean, his body of work is just, stunning. And still, there are no policy changes. We're still using chlorpyrifos, which is an organophosphate pesticide that was banned in the EU, in all of the EU in 2020, and was not used in multiple EU countries for many, many years because it's really, really bad for the brain and for development and for the immune system. We're
still using 10 times the amount of glyphosate, Roundup to those who don't know what glyphosate is, on our crops, on our farm fields, 10 times the amount that is allowed anywhere else in the world. Europe doesn't allow anywhere near that amount. And the companies like Bayer who are poisoning our system, and you talked about food supply earlier, they're the ones who are also helping to write the laws and laws that exonerate them from any liability that their products may cause. There's something wrong with that, seriously wrong with that. And Brenda, by the way, I wish Jacqueline Capriati were here to hear you talk about listening to the parents, because she's a mom with two children with cystic fibrosis, and we've become good friends through this journey, and that's a major point of hers as well. And listening, and that's what Bobby Kennedy does so well, right? He listens. He'll listen to the parents, and you can examine his relationship with Lynn Redwood and many of those vaccine injured moms who came to him directly and got him involved in what he calls the worst career decision he ever made. But he followed his heart, he followed his moral compass, and did the right thing. And he's not concerned with the cost to him personally. That's why I'm always in such awe of people like him and people like both of you, who actually walk that path in the face of the fire that could come at any time. it's a risk. Now, I'd like to play a clip, guys, because Brenda, you mentioned Dr. Prasad, and he just came out with a clip a couple of days ago. Now, for those who don't know, he is one of the truly foremost experts here, and he talks about this study that I think, and I'm only going to play a minute or a minute and 20 of this clip, and then you'll see what I'm talking about here. It's a great piece of information.
There's a new paper out now in the journal Vaccine, and it's about the COVID-19 vaccine and some of the harms due to the vaccine. It's the largest observational analysis of 99 million people, and it's entitled COVID-19 Vaccines and Adverse Events of Special Interest, a multinational global vaccine data network cohort study of 99 million individuals. They like to put the 99 million in the title so they can try to get accepted in a good journal, and they actually did this time. And this paper shows very concerning safety signals across a number of domains, including myocarditis, pericarditis, ITP, Guillain-Barré syndrome, Bell's palsy, ADEM, pulmonary embolism, febrile seizures, and more. I'm going to talk about those concerning safety signals seen in this paper, but I want to talk more broadly about what the paper shows and why it is so unnerving, because I think it suggests rather strongly that there were safety signals that have been ignored and underexplored, and that in many populations, particularly young people, particularly people who had already had and recovered of COVID-19, and for many additional doses beyond dose 2+, 3+, 4+, 5+, it is quite likely, in some cases you can easily show, for instance, young men between the ages of 16 and 24, but in other cases it's probably quite likely that the harms outweigh the benefits for vaccination in that age group. And that means that the mandates in those age groups are deeply morally problematic or scientifically problematic, and they bankrupt trust in public health.
Boy, is that well said or what?
And one of the things that we're learning, and hopefully the message is getting out, is that science is not religion. Science is evolving. It requires us to be able to hold opposing points of view and work toward a solution together, as opposed to letting it be dictated, which I think a lot of people fell into with these mandates, and many people, like you're describing, began to experience it as some form of medical tyranny. And all I would like to see, and I'm sure many people are on this page, we would like to lay down those gloves and say, pro-vax, anti-vax. Let's stop with that tribalist rhetoric, right? And let's learn to come together and seek the solution, and recognize that there is correlation here. There is correlation. We've talked about some of it today. So let's do the studies. Let's have somebody in the White House who's going to ensure that the studies are being done, and not having his agenda dictated by some special interest or ulterior motive, right? What do you got?
Well, what comes to mind for me is just informed consent. And, if a parent is trying to make a decision about any medical intervention for their child, from a vaccine to a medication to anything, they really need to know certain things, like what the safety, what safety studies have been done and which ones haven't been done. And I think it's really important for parents to be respected in that decision. They know their child's health, the pediatrician knows that child's health, and if a certain vaccine, or let's say collection of vaccines, right? If one vaccine is safe, does it mean giving them 5 vaccines is also safe? Does it mean giving them 72 doses of vaccine by age 18 is safe? Has that been studied or not? And those are the kinds of things that I think parents need to know, whether it's a COVID vaccine or any other vaccine, that, just respecting parents in making that decision. If they know there are certain risks or certain things we don't know. We don't know if giving your child these 10 vaccines in 1 year could possibly affect their chances of getting ADHD, ADHD 2 years later, or having an immune system and a greater risk of autoimmune disorder 10 years from now. There's certain things we just don't know. And unless we do these research studies, and prioritize those research studies. At the very least, we need to be able to let parents know that we don't know whether a vaccine is completely safe.
And that's all Mr. Kennedy has been saying. And,
Exactly.
we really need to learn more. And he just constantly gets attacked for just bringing up this issue.
I mean, I think this is where, I think sometimes communities of people are kind of missing each other. So I think on the one hand, control of infectious illness is incredibly important. And there are bad outcomes from people who have, certain kinds of infectious illnesses. And control at a population level is very important as well. And it is true that for certain kinds of side effects, vaccines are incredibly well studied. Traditional childhood schedule. We'll get back to the COVID vaccine and Vinay's comment in a second. On the other hand, it is also true that we do not study vaccines for their off-target, long-term effects on the immune system or other outcomes. This work has been highlighted by a wonderful researcher from Denmark named Christine Stabell Benn, among many others, who really have shown, I think quite convincingly, that vaccines have non-specific off-target effects on immune functioning. And we're not studying that. So I think that's the question that many people have. And it doesn't have to be either or. Yes, control of infectious illness is important. Many people rightfully, believe that vaccines are an incredibly important intervention. And it's also true that we don't know the long-term effects. And another aspect that has been understudied is cumulative effects.
Right.
So we typically study vaccines in isolation or sometimes in groups of 2 or 3 vaccines in certain studies, but we're not studying the cumulative impact of all vaccines together. Right. That was true during COVID too, when the recommendation was made by public health authorities that it was totally safe to give the flu vaccine together with the co-vaccine. It had never been studied, never. And then also that issue highlights, simultaneous administration also has understudied. And I think, to say these things somehow puts you in the camp of an anti-vaxxer. I'm vaccinated. I was very happy to get the hepatitis B vaccine in medical school when I was hit with a needle for someone who was hepatitis positive. My children are vaccinated, but I think if we want to regain public trust, we have to acknowledge that there are aspects of our current program that are understudied. And we don't know if there are long-term issues. This is why, getting back to Vinay's comment, first of all, who's been mercilessly attacked, right? But even in this study of 99 million people, they only studied certain pre-specified outcomes of interest. Guillain-Barré, certain clotting, certain neurological conditions, certain clotting disorders, cardiac conditions. They pre-specified outcomes. What we really need to be studying for all medical products is longer-term all-cause morbidity, meaning bad outcomes, all comers. Same thing for medical products. We should be studying all-cause mortality, not just pre-specified reasons. For example, if you're studying a new drug and you have 10,000 people who got placebo and 10,000 who got the drug, but there are more deaths in the people in the group that got the drug. But some of the deaths are a car accident, someone fell off a roof, and those are typically discounted. Who's to say that product didn't cause overwhelming dizziness, that person then got into a car accident or fell off a roof?
Sure.
So I think all-cause morbidity, all-cause mortality should be the standard of evidence-based medicine for all medical interventions. And we're definitely not doing that for almost anything that gets approved. In terms of our vaccine surveillance safety system, we do have a great resource called the Vaccine Safety Data Link, the VSD, which is a massive database that looks at a number, I think maybe 8 or so HMOs that voluntarily submit their electronic health record data to this massive database. And it's used to look at things like outcomes and vaccine surveillance in particular. We could be doing all-cause morbidity studies looking at that database. As far as I know, if those are being done, they have not been published. And of course, another issue with the Vaccine Safety Data Link, VSD, is that it's not open to the public. So, I mean, there are simple things we could be doing to improve public trust.
And is it because
the VSD open to researchers from a range of, it's fine if you want to limit it to academic institutions even. That, okay, yeah. People who really have the expertise to do methodical and valid kinds of epidemiological, inquiries. Anyway, I think there's a lot of ways we could be improving trust and through transparency. And instead, it seems like what we have now is targeted harassment of people who are bringing up, safety concerns. I think Vinay Prasad is a great example. Tracy Hoeg, who was bringing up issues of myocarditis and pericarditis earlier in the pandemic, was, at least online, was attacked mercilessly as an anti-vaxxer. And she's like this incredible, thoughtful researcher who just wanted to make sure that the harms were not outweighing the benefits. I mean, it's...
And then there's Dr. Bhattacharya, who, should he be head of the FDA, the CDC? Where would you guys put Dr. Bhattacharya if you could?
Put him in there somewhere, please. Please. Yeah.
Yeah. Did you see the picture that Nicole Shanahan, I think we'll get to the bottom of a lot of this. And she was pictured yesterday with Dr. Mary Talley Bowden from Houston, who also was mercilessly attacked by her own hospital and, deplatformed everywhere, smeared. They really went after her, and she stood tall, and now she's in a position to, I think, help change things for the better, change the world. And I know that there was a time when there were only 3 or 4 vaccines back in the 1980s, right? And my understanding of the history, and I learned a lot of this from Bobby Kennedy, is that Wyeth at the time, I believe, was the company who was who had the DTP vaccine, and they went to the Reagan administration and said, we can't we can't make money with this because 1 out of 300 people are being injured. And so we pulled the DTP vaccine, but what the law was changed to exonerate these vaccine developers from any liability. Only the Army Corps of Engineers gets that exemption. And now they get these EUAs for all of their vaccine development. They don't go through the same rigors of testing that other drugs have to go through. And lo and behold, wouldn't you know it, human nature, we have this sort of gold rush of vaccines where now the schedule has how many doses? Over 70 doses, 17 different vaccines. And what scares me, guys, maybe you can talk to this, because again, my understanding, and this was highlighted during COVID, but maybe true elsewhere as well, is that if there is an existing drug that can be repurposed to effectively treat to replace the vaccine, to treat whatever the infection is, or the virus, then the law says you cannot develop a vaccine if there is something available that can be used to treat that virus. So I'm wondering if there was some political motive there to kind of play down some of the other drugs that were available. Do you have any thoughts on that?
So I'm, definitely not an expert on COVID treatment or the use of repurposed drugs. I'll just go back to a couple of things you highlighted. So the law that you're talking about is the National Childhood Vaccine Injury Act. I think that was in 1980. It was passed in 1986. Yes. And what that law provided for was for certain kinds, actually very wide liability immunity for pharmaceutical companies who make vaccines. I will just add that on the one of the arguments, of course, is that there are a lot of frivolous lawsuits for products, medical products, and so I think supporters of that act would say that it protected pharmaceutical companies from expensive litigation, that was potentially frivolous. And also it provided for the Vaccine Injury Compensation Program, VICP, which at the time was, the idea was to actually make it easier for people who were injured by vaccines to receive compensation rather than having to go through years of expensive litigation against these, monstrous corporations that have unlimited amounts of money. Unfortunately, we can easily see that there are downsides to removing liability, for products. And also, I think many articles have covered that the VICP has enormous backlogs, that the amount of compensation for individuals is actually quite low. It was one of the issues raised in the article, I think, in the New York Times, was that many people who believe they were injured by the COVID vaccines can't seek compensation. That's a separate program. It's distinct from VICP, but who have not received compensation for injuries. So I think the issue is very complicated. I think it's important that we understand that some aspects of these policies are well intentioned, and but I think you're pointing out potential downsides.
They start out, it's always right. It always starts out with the best of intentions, right? And I don't know if there's an easier way or a better way to somehow keep the guardrails from that human motive of whether it's greed or just the desire to engage in a power grab, but there's something,
or even to make products that are helpful. Like sort of the Haemophilus influenza type B vaccine, the Hib vaccine, has led to, and the meningococcal vaccine, there has been massive decreases in the rates of meningitis among newborns and infants. I mean, meningitis was a huge issue, even for pediatricians training in the 80s and early 90s. It's been a massive decrease. So I think that we have to, and we haven't studied long-term off-target effects. So I think we have to be nuanced about this. Again, I think this is one of the ways that Bobby Kennedy has gotten a bad rap in the media, because I actually do believe he can talk about these issues in a nuanced way. But usually whatever he says, gets edited to, sound like the worst possible version of someone who's, an anti-vaxxer. And that's not how I understand him and his policies.
Mm-hmm. Pro-safe vax is a better way to put it, I think.
Well said.
And
well, we're going to have you both back on. I know we've run over your time today.
We have. Thank you. Yes, we're. Oh, wow, look at that. And both of you, I love how you bring this sort of balanced approach and this nuanced approach that you, to use your word, and considering both sides and holding opposing views and keeping that open mind. It's so important, right? And that's how we really make progress. So thank you for that, and thank you for your for sharing your experiences here today. It's been great. Just you're welcome back anytime. So thank you.
Absolutely.
Thank you, Brenda. Thank you, Paul.
Thanks, guys.
Paul, thanks, Brenda.